Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and I'm exactly one half of the Bob and Brad team. My guest today is going to be Dr. Terry Wahls, and this is a fascinating story. If you have MS, an autoimmune disease, or even a neurodegenerative disease, if I can say that right, you're going to want to listen, because what she has done with diet and a few things in addition to diet has been absolutely amazing. She went from, I don't want to give away too much, but she went from being in a wheelchair to walking. So please join me in welcoming Dr. Wahls. Dr. Terry Wahls, thank you very much for joining us today.
Thank you for having me.
Really appreciate it. I'm going to go ahead and just jump right in. Could you give us your backstory?
Okay. So, about 20 years ago, I'm out walking with my wife. My left leg grows weak, dragging it a hobble home. I see the neurologist the next day who says, Terry, this could be bad or really, really bad. Now at night,
wow,
I'm thinking about the 20 years of worsening face pain due to trigeminal neuralgia. So actually, I'm praying for a fatal diagnosis. 3 weeks later, I hear multiple sclerosis. I see the best people, I take the newest drugs, but I continue to relentlessly decline. 3 years later, I hear tilt, recline, wheelchair. Mm-hmm. The trigeminal neuralgia is also getting worse. But I know I'm a physician, so night after night, I'll go to PubMed to read the basic science, and I begin experimenting on myself. Based on what I'm reading, I develop theories that the mitochondria are the driver of disease, and I begin taking supplements targeting my mitochondria. I've already adopted the Paleo diet 2 years earlier, but who knows how long it takes for that to reverse my damage. I stay with it. By 2007, I am so weak I cannot sit up at a regular chair. My zingers are relentlessly worse. It's clear I'm headed towards becoming bedridden, demented, and living with intractable pain. And that's when I discovered study using electrical stimulation of muscles and asked my physical therapist, can I try that? He calls it e-stim. My test session hurts bad, really bad. But when it's over, I feel great. And I begin doing e-stim to as much pain as I can tolerate. Now, my physicians tell me again and again that with secondary progressive multiple sclerosis, functions once lost are gone forever. That's why I've been so aggressive with my drug treatments. But, am I really doing everything that I can to slow my decline? I've been doing e-stim, I've been doing the paleo diet, I've been doing supplements. I have a big aha. I redesigned my paleo diet based on all the science that I've been reading and on what I've learned from the Institute for Functional Medicine. I go back to meditation. And 3 months later, those zingers are gone. My physical therapist says, Terry, you're getting stronger.
Wow.
And I begin walking, first with a cane, then without a cane. And 3 months after that, for the first time in 6 years, with my son, Zach, jogging alongside on the left, my daughter, Zeb, on the right, and my wife, Jackie, following behind, I get on my bike.
Amazing.
And I bike around the block.
Amazing.
My son is crying, my daughter's crying, my wife's crying, I'm crying.
That's
and when I tell that story, tears come to my eyes again. And 3 months after that, Brad, I do an 18.5-mile bike ride. You're Bob?
Yeah.
I got the wrong guy?
Yeah.
Okay, Bob, forgive me.
Yeah. You did 18-mile bike ride?
Yeah. So then I did an 18.5-mile bike ride.
Oh, crazy.
And of course, this changes how I think about disease and health. It changes the way I practice medicine, and it will ultimately change the focus of my research.
How did you keep it all together when you had first got the diagnosis and you started to decline? I mean, this is worst case scenario. I mean,
yeah, when I'm first diagnosed, my son is 8, my daughter is 5.
wow.
And I had been a athlete, a black belt athlete, competing nationally in taekwondo, running marathons, skiing marathons, physically very, very active. And I'd assumed that I would teach my children, the skills of life through athletics and wilderness travel.
Right.
And within 2 years, it's clear that walking's become very difficult, and I'm having to continue to reinvent who I am and how I parent. But I would also say that my children were probably saved my life, because I knew my kids were watching.
Right.
And I could either give up as life got harder,
Sure,
or I could keep doing the best that I can and model that, yep, life's not fair. You have plenty of hardship, plenty of struggle, but you get up and every day you do the best you can anyway.
yeah, because I mean, the way I see it with MS, it was going to take away 2 things that are really important to you. I mean, 1, your athletic ability, and also 2, your thinking.
Correct. So it took away my athletic ability. That took that away very quickly within 2 years. It was also apparent that it was giving me a lot of pain. Pain was certainly a very big part of my experience. And having to learn, and then it was encroaching on the tasks of daily life, walking. And at the very end, at my nadir in 2007, it was beginning to encroach on mental clarity as well.
Sure. Like brain fog type of thing.
Correct. And when I was diagnosed, my neurologist said, "Don't worry, cognition is never affected." Of course, now we know that in fact is wrong.
Right. Dr. Wahls, at this point, I want to make sure we list your website and your book, because some people will go back to the start of this video or podcast. And so I've got your book.
I love the book. Thank you for holding it up.
Yeah.
So my website is terrywahls.com.
Very simple. And
the book, The Wahls Protocol, and then there's the companion cookbook, The Wahls Protocol, Cooking for Life. And if you want to get just a 1-page summary of the diet that I use in our clinical trials, that's terrywahls.com/diet. And if you want to follow me on Instagram, you can see what I'm eating most days. People find that a lot of fun. And we have a variety of educational, inspirational stories, et cetera, on Instagram.
Now, this is not just for MS. This is for all autoimmune conditions.
Absolutely. Because when I was diagnosed, I'm at the VA, and my clinical practice was at the Veteran Affairs Medical Center. And as I recovered, I was using my principles in the traumatic brain injury clinic and in the primary care clinic. The VA was so impressed with how efficacious, how helpful what I was doing was. They pulled me out of primary care and had me create my own clinic, which we called the Therapeutic Lifestyle Clinic. So I went to the pain clinic, the specialty medicine clinic, primary care, and said, "Give me your most difficult cases that you can't really help, that are still suffering, you'll continue taking care of their drugs. I will work with them on their diet and their health behaviors.
Sure.
And what they saw, so people came with all sorts of autoimmune conditions, inflammatory bowel disease, rheumatoid arthritis, systemic lupus, fibromyalgia, and the common symptoms were pain, fatigue, brain fog. And they had many, many comorbid problems like anxiety, depression,
Yes.
high blood pressure, obesity, cholesterol problems. Sometimes they had heart disease. And as we implemented the concepts that I taught, blood pressures improved, blood sugars improved, pain went down. And we had many young men and young women from the Iraq War, Afghanistan War, and they certainly had suffered a great deal. The young men would come in. It'd take them several months, mind you.
Sure.
With a big smile and say, "Doc, you didn't tell me I'd get my love life back."
Fantastic.
And the ladies were thrilled because they were losing weight without being hungry.
Sure.
But they were, when having conversations with them, they'd be like, well, their love lives were improving. And the men whose love life had been improving, they had been losing weight as well. So in a very sexist way, I'm going to say it was sort of very typical that the men were thrilled about performance and the ladies were more thrilled about appearance.
You think that's it's because it takes away the inflammatory nature?
Yeah, I think for many of the veterans, there's a lot of oxidative stress, a lot of inflammation, just from the military experience, from the toxins that they're exposed to in their military life.
Sure.
That we improve their toxin processing capability. We improve their nutrition so that reduce their oxidative stress, reduce their inflammation. And as those pathways were improved, the gene expression that drives inflammation, calms down.
Sure.
And so that excess fluid that we have in what's known as the extracellular space, the space between cells, is lost. So people, lose a lot of water weight from that extracellular space in the first few weeks. Then they begin losing more fat. And though I did not have the capability of measuring fat mass and muscle mass, what I would predict is if we had done that people were losing fat and probably retaining muscle.
Sure. So are a lot of neurodegenerative diseases, are they autoimmune? Like, let's say Parkinson's?
Well, that's sort of a complicated question. And I'm going to sort of get to the root cause of disease processes. When our cells are encountering damage or a threat, whether it's infection or damaged cell because of a chemical injury or a heat injury or a cold injury or a fracture, the cells respond by generating a threat signal that drives up inflammation. And it does that through activation of the mitochondria. And so that can also drive up oxidative stress at the same time. And we will see that in response to infections. And we see that in response to autoimmune processes. And we see that in response to diseases that we thought had nothing to do with infection or autoimmunity. Things like anxiety, depression, cognitive decline, and Parkinson's.
Okay.
So on a macroscopic level, when we would make diagnoses, as we did for hundreds of years, based simply on the physical exam of the gross human body and the history, you would classify these diseases in reproducible ways: Parkinson's, Alzheimer's, multiple sclerosis, anxiety, depression. But when we look at things on a cellular and biochemical pathway and mitochondrial pathway, the lines start blurring. And so it makes me think, Bob, that when I first started, changing how I treated patients and started focusing more on diet quality, stress reduction, movement, my chief of staff called me in to say, Terry, what are you doing? I hear you're treating everyone the same way, and you can't treat all diseases the same way.
Mm-hmm.
And I'd say, well, I'm not really treating disease. I'm focused on creating health.
Sure.
And furthermore,
Absolutely.
I'm focused on cellular health. I'm thinking about improving the nutrition for the mitochondria, for the cell membrane, and for the cells. And we have, all of us have those things. So that's what I'm focused on. And then I'm just watching, are people's needs for the medication changing, so I don't end up having anyone who's over medicated? Because if their blood pressure begins to fall, I need to reduce their blood pressure.
Right,
meds.
exactly.
And if their blood sugar is beginning to fall, I have to reduce their blood sugar meds.
Right.
If they have less pain, I should be reducing their pain meds. And so I learned to be much more careful about how I talk to my patients and how I documented the medical record, so that this was understood that my focus is creating health and then monitoring for potential side effects from medications, so people are not over medicated.
Right. Makes sense.
That I continue to let the person work with their specialist who's treating their other disease states.
Mm-hmm.
So I'm not interfering with what the specialist is saying about their autoimmune problem, or the neurologist is saying about their neurologist problem. I'm just working with the patient to create the best health possible.
I want to mention that you had a TED Talk called Minding Your Mitochondria, and it's, last I saw, it had like 3.6 million views.
Yeah.
So would you just explain for the layperson what the mitochondria are?
Oh, sure. So all of us have within ourselves a smaller component that's called an organelle. And one of those organelles is the mitochondria, which is basically a ancient bacteria that had been engulfed by a bigger bacteria about 3.5, I think it's about maybe 2 billion years ago. And that allowed those cells to use oxygen much more efficiently. And that cell then would eventually evolve into multicellular organisms and animals and mammals and primates, and of course, eventually us. It allows the cells to generate energy more efficiently, so the cells could specialize into muscles and brain producing cells. And if those mitochondria are producing energy very efficiently, that cell will be healthy. It can do all the tasks. If the mitochondria is not producing energy, it generates called oxidative stress, and it doesn't do the job very well. And that's when, in my clinical practice, I think about mitochondrial strain when someone is having fatigue, having heart failure, having problems with their vision. And I also think about that if they have a complex chronic disease, that is part of that problem.
Gotcha. It's just ironic. I just had a person our podcast, and he talked about light therapy. And I saw some research where they said red light near infrared light may actually have a positive effect on mitochondria. And I thought
Oh
of you
yeah.
right away.
So yeah, I'd love to address that. All of life, for the about 3 billion years that we've had life on this planet,
Right.
life has been outside in the sun, and the sun energy
Yes.
interacts with the cells supporting the generation of energy. The plants do it through photosynthesis. It turns out that light also has some interactions with our mitochondria as well, and that it's helpful for us to be in the light. And red light is particularly helpful in boosting the efficiency of some of the mitochondrial processes.
Right.
It's not as good as photosynthesis, mind you.
Sure.
It's not as good as photosynthesis.
Right.
But still, red light is good for us. Ultraviolet light is good for us, in small doses, particularly in the morning. It gets us our circadian rhythm, that is the timing of all the cell processes well aligned. And red light is very healing. Being away from light, being just in the artificial light that you and I are in, is not as effective with our biologic systems.
He made 2 points to that. You actually can get light, sunlight on a cloudy day. You just have to go outside yet. And also you can't get it through a window. So I didn't know that.
That's correct. The ultraviolet light is blocked by a window.
Yeah.
So we probably get some benefit because being in a light with a window decreases the harm from the artificial lights that we have.
Sure. Good point.
So it's still beneficial to have windows.
Really good point.
But you really want to go outside, and you also want to be outside without sunglasses for at least part of that time.
Yes, he said the same thing. Yep.
So you get the light into your retina.
Yep. Well, you're so smart. Well, things too. So do you have any indication of, I know this is a really vague question, but how many people you may have helped? I mean, obviously you are helping people.
Well, I love that question. So the TED Talk has had, about 3.8 million views.
Sure.
So those folks and their families and their sphere of friends. So that'll be millions. I teach clinicians every year for the Institute for Functional Medicine, for the American Academy of Anti-Aging Regenerative Medicine. So I reach tens of thousands of clinicians through those two organizations. And so all of their practices as well. And then I have run courses for the public. My book has had many hundreds of thousands, I think 400,000 copies plus.
Oh, wow.
That have been sold. So certainly millions.
Fantastic.
And then on top of that, the other thing that gives me immense satisfaction. So, in 2008, when I had my recovery, and then in 2009, I began talking in the local organic grocer about my experience. And then the local MS Society wants me to speak. And I get interviewed by their clinical advisory committee, who decide that my message offers false hope and is dangerous, and I'm banned as a speaker by the MS Society. But, okay, that's fine. So I keep talking where I'm invited. To various local, regional, and then national meetings. My TED Talk comes out, my book comes out. The MS Society tracks me down, says, would you come to our wellness conference? And they apologize, and they unban me. I go to that conference.
Wow.
And they, as a result of that conference, I help them along with making dietary and wellness a research priority.
Sure. With
reconstituting their review process of scientific proposals so they could review dietary and lifestyle research. And we started publishing our studies. And so, we did case reports, case series, feasibility studies, small pilot studies, larger pilot studies. We're doing larger studies. And in that now 12, 13 years, I've gone from being condemned as dangerous by the neurology community,
Sure.
to being heralded as a major dietary and lifestyle researcher by the neurology community.
Fantastic.
Being recognized here at the university and by many more within the neurology world as this innovative research. And if you search for the papers that have been published on dietary interventions, my lab has published the most dietary interventions, the largest studies with the longest study interventions. And we're getting ready to launch another new dietary efficacy on efficacy of diet on quality of life in MS. That'll be a 2-year study. Bob, I want to be sure that you have the links to put this in your show notes, because we'll probably be screening for enrollment, I would think, in early February.
Absolutely.
And today, as soon as we're done, I'll go back to working on my grants. So, we keep having these wonderful ideas, and we keep sending off grants to get funding to continue to investigate this really important area of what is the role of a better diet, stress reduction, and physical activity for having better outcomes with MS, which is the disease state that I investigate.
Yeah, you covered a lot of my questions right there. I mean, I was talking about pushback from the medical community, and I'm glad to hear that they're coming around.
Oh, so let me tell you the pushback that happened. When I first made the transition, and I'm people are thrilled that I'm walking again. Like, oh my God,
Right.
Everyone's thrilled. But I'm talking to the medical students and the residents about biochemistry. I think I'm talking about the latest drug, but I'm really talking about broccoli and turmeric and cauliflower and onions and mushrooms.
Right.
And so, and I'm talking to the vets about diet and lifestyle, and I'm being very effective at getting them to make some big changes. But some people are complaining. So my chief of staff calls me and says, "Terry, what's going on?" People are complaining that you're not doing the standard of care. And I've heard you've been banned by the MS Society as a dangerous, because you're dangerous. So what are you doing?
What a start.
Now, fortunately, I've been prepared for this. So I had a handful of my scientific papers. I brought them down. I went over with him, and I won him over. He also impressed on me that I should go meet with the chief of the complementary alternative medicine to learn how to document what I was doing in the medical record, so that if someone complained,
Sure,
as they were, my medical records would pass review. So that I was much more careful. I'm creating health. I will continue to treat chronic disease in the usual way, but I'm going to focus on creating health. I'll monitor for the blood pressure, the blood sugars, and adjust medications as needed. And so once I changed how I began talking about it in the medical record and in the public, then it was much more comfortable for my colleagues to hear the message.
Really supports the belief that the pioneer gets all the arrows. So.
Oh yeah, man, you got to really be. You have to be okay with the fact,
right,
that when you're innovative, people say, like, "What the hell are you doing?" Right,
exactly.
And interestingly enough, I think part of the reason I've been successful is because I'm gay, and I had to go through my own personal transformation to be comfortable with who I am.
Sure.
Even though early in my life, there's a lot of messages about not being comfortable with who you are.
Sure.
Which allowed me to feel comfortable with all sorts of criticism from my colleagues for doing things so radically differently in my clinical practice. And then when I started doing the clinical research, And, my first study was, we were replicating everything I did, which was, targeted supplements,
Right.
diet, meditation, exercise, electrical stimulation, a very complicated regimen. And all of my scientific partners and peers were saying, that's terrible science. If it works, you won't know why. But fortunately, the chair of medicine, who was a rheumatologist who had seen this transformation, he called me to his office and said, this is the study you need to do. It's your protocol. The questions you're asking are, can other people do what you did? Do you hurt them? Will they actually, so will they do it? That's called efficacy or tolerability.
Sure.
Safety, the question is, do you hurt them? And then the third question is, what's the effect size? And so, again, severe criticism from many folks. And it was, fortunately for me, the chair of medicine had become the dean of the College of Medicine. And I had been on the institutional review board, and they'd see me go from, athletic to wheelchair,
Right.
and then back out walking again. So my study did get approved. It took me about a year, but we got it approved. And we were able to show in that first cohort of 20 folks with progressive multiple sclerosis who were exhausted. They're on canes and walkers.
Right.
They could radically change their diet. They could take those supplements. They could exercise, even though these people are profoundly disabled. Who got them exercising. We got them doing e-stim. We had radical reduction in their fatigue severity, improvement in quality of life, reduction in anxiety, depression. And the other thing that's remarkable is that half of these folks had clinically meaningful improvement in walking.
Wow.
Now, with progressive MS, you anticipate a 10 to 20% decline each year. So the fact that as a group we held them flat for a year was remarkably, that was really quite remarkable. And the fact that half of them improved, remarkable. And I ran into some of these folks now 10 years later. So they're in their 70s now.
Wow.
And they're still walking around, and I practically go around the state, talking, giving a presentation when I have a new study that I'm recruiting for. So my former subjects, study subjects who are in that area always come to the meetings.
Oh.
And it's like a
nice.
revival meeting. So I give my presentation. My former study subject stands up and says, I was in her first study.
That's very powerful.
And they tell their story. And then go on to say, and if I stop doing the stuff she taught me to do, I can't walk again.
Wow.
I'm exhausted. And as soon as I go back, my energy is back, my balance is back. And so do what Dr. Wahl says.
That's motivation.
Make all the difference in the world.
Yeah, based on what you're saying, I mean, it sounds like they all improved really because you held them stable and half.
Correct. In progressive MS, if we can keep you stable, like,
right.
Oh my God,
that's a big,
that's heroic.
Yes.
People take drugs that cost $90,000 a year
with side
with
effects.
the hope of staying stable.
Right.
Because none of those drugs are to make you better. They're approved to prevent worsening.
Sure.
To prevent relapses. And that's what they do. They prevent relapses, but they don't prevent the neurodegeneration, which is the slow accumulation of disability.
Well, thank you so much for this. Again, we're going to mention everything again. The Wahls Protocol is the book, and you have the cookbook also, and terrywahls.com. You can find a lot of information there. I mean, really, there's so many people that should look into this. And this book, by the way, has so much more information than just the diet. I mean,
yeah,
you cover everything. Soup
much
to
more
nuts.
than diet.
Yes, absolutely. So really, it's been my honor to have you on. I hope we can help a lot of people. I'm sure we can. So anytime you want to be on, the door is open.